Hi everybody, it's Ashley of Day to Day Social Work. I'm a private online tutor and I specialize in assisting people to pass the license exam in social work on the master's and bachelor's level. I can be found online at daytodaysocialwork.wix.com/my site and on YouTube at Day to Day Social Work. I wanted to come to make a video about my job as an ambulatory care manager social worker. I made a video probably last year when I was working at the police department about my job as a victim advocate, and I've gotten a lot of questions about it for people that were looking to go into that kind of position in that part of social work, and so I decided that it would be good to make a video dealing with what I do at my current job now. So I have been on this job for a year next month in October. Well, hey, it is October. So I've been on the job a year this month as an ambulatory care social worker. And when I applied for the job, I had no clue what ambulatory care meant. And so I was doing a lot of research and trying to figure out what exactly I would be doing at this job. I had no experience as a medical social worker at all. And so I was just Googling and trying to find out what ambulatory even meant. So basically I work in the outpatient part of the hospital with patients who are sent home, and we work with them from home, and that's basically what ambulatory means. So I'm an ambulatory care manager. So I'm kind of like a case manager, really. I manage a load right now of about 35 people, and then we also have consultations that we do for people. So the population that we manage is a population of people who have chronic illnesses, including pneumonia, diabetes, congestive heart failure, pneumonia, diabetes, and there are like two others, but I work specifically with pediatrics as well. So when I got hired, I thought I would be working with only adults, but then when they found out my background with working with people that were homeless and families and children, they decided to put me in a specialty of pediatrics. And so I work primarily with children who have type 1 diabetes as well as their families. So aside from the pediatric patients that I have, I also have those patients who are elderly, and they, like I said, have pneumonia, COPD, congestive heart failure, or diabetes. So basically we work on the team. We have a nurse case manager. Most of the nurses are RNs, and they have or BSNs or MSNs. They have bachelor's and master's degrees, and we work remotely. So we work from home. We're at patients' doctor's appointments a lot. We're in the home sometimes, and we work from home. And it sounds like fun to work from home, but it's really not. Like, it's good. I don't want to go back into the office, but at the same time, it's like you wake up, and some days you're working from the time you get up until the time 5 o'clock hits. But I always have my phone, so they gave us a work phone, and they gave us a laptop to take home, of course. But anyway, so I manage a caseload of about 35 people right now, and basically there's a process. So a patient who has one of these diagnoses will go into the hospital, and then someone will transition them out. A nurse or discharge planner will transition them out of the hospital and into home, and we get that information, and then they send that information over to us on this big list, and then people skim through the list and they pull out the patients that we could follow for case management to help them manage their chronic illness, and so those cases go to the nurse. So the nurse is the lead of the case. So once the nurse gets the case, they help them with appointments, they help them with managing their diabetes or their blood pressure. They call them and make sure that they have their medication and that they're taking their medication and being compliant. and that kind of thing. And then sometimes they'll have a social need. So that's where I come in as a social worker. We're kind of consultants on the case. So a nurse may not know something about domestic violence, or they may not know about where the person can get resources for housing or how to pay for their medication and that kind of thing. And so they will then contact the social worker to call the person, and we will be on the case and on the team. And depending on their acuity or how serious their condition is, that's how often we contact them. So someone with a high acuity, we would call once a week or more. Someone with the medium level acuity, we would call every 2 weeks or so, maybe 3 weeks, depending on their needs. And then someone with the low acuity, we would call like once a month just to check in and see how things are going. And so the nurse case manager and the social work case manager could have 2 different levels of acuity. So the nurse could be, let's say we're following a patient with COPD, and they have a whole lot of issues and with getting their medication and their oxygen, or they have some kind of need for physical therapy or occupational therapy and that kind of thing. So they have all these constant medical needs. The nurse would probably have them at a high acuity, whereas I would be on the case, let's say, with a medium acuity, because they only need help with buying their medication. And that's a process, because if they apply for assistance with purchasing their medication, the manufacturer has to send them the application, and then they have to get things filled out. So I might only call them every 2 or 3 weeks, whereas the nurse would call them every week or multiple times a week. And so we would follow the case for maybe 3 months, 6 months, or until the patient gets better. And the whole point is to help them not go back into the hospital. So that's kind of the purpose of us being there, to follow their cases and help them manage their condition, so that they won't overutilize the hospital as a means of primary care. We try to get them into their primary care doctor to save money instead of using the ER as a first point of care. But it's a little different for me, because I also work with pediatric patients, and so those cases are way more intense than the adults, because normally the adults just need Meals on Wheels, or they need to apply for Medicaid, and you can send them an application, their family can help them fill it out, or they're able and cognitively able to fill it out on their own, and sometimes you have to do it with them or for them. But a lot of times the adult patients are a lot more simple, because it's like one need that you can just refer them out. Working with the pediatric patients, I've found it's so much more intense, because it's more of a family issue, and all of my pediatric patients have type 1 diabetes, and so the parents are responsible for helping the children manage their condition. And a lot of these families have a lot of social needs where they don't make a lot of income. The children are on Medicaid, and that's a good thing, because at least they can get their medications and afford to go to the doctor and things like that. But a lot of these kids are teenagers, and they don't want to have diabetes, and I learned so much about type 1 diabetes that I didn't know prior to this job, and it's just a big inconvenience, and it's a very big stress for a teenager to have to stop their life and not be able to be normal like the other teenagers around them, and have to check their blood sugar several times a day, and give themselves insulin, and do corrections for carbs that they eat, and all this other kind of stuff. So I've seen cases with domestic violence in the home, and we've had to resolve that, and making mandated reports to Child Protective Services, and just parents not parenting well, or not enforcing treatment plans for their children with diabetes. And I've gone to schools to meet with the school nurse, to meet with guidance counselors, to talk about grades. And I have a lot of teenagers that are cutters. We've had a kid that was suicidal. He attempted suicide and was taken to a facility. So these cases are a lot more intense because of the family dynamic And because of things going on in the home environment and at school and a lot of psychological issues, we have kids with behavioral issues. So it's a whole lot. But it's social work, and it can be overwhelming sometimes, but I like it. And then what else? Like today, for example, today I went to a doctor visit with an endocrinologist for a child with type 1 diabetes. She's 13 or so, and hers is pretty well managed. We look at the A1C a lot, and the A1C should be around 5 or 6. This kid's was like above 10, and so we try to get that down. But the kid needed counseling. Her mom said that she wanted her to go to counseling, but I've been working with them since before the summer, and the mom hasn't followed up with it. So that case in particular is very minor compared to some of the other cases that I've gone to, home visits where the home was just in deplorable conditions, dogs everywhere, animals everywhere, just unclean, unsanitary. And you have to manage diabetes in that kind of environment. It's not really good. So then I went to a home visit, a surprise drop-in, a welfare check rather, for a patient who has a whole lot of issues. She's an adult. She's in her 60s. And I talked to her last week. She was throwing up. She called me, left a voice message, breathing very hard, very, very hard over the phone. It really concerned me. I called her back. She had a lot of things going on. And so she told me she was throwing up acid and like all this stuff. So I got the nurse involved in that case. And then I wasn't able to get in touch with her late last week on Friday, so we went and did a welfare check at her house, and she ended up being taken to the hospital by ambulance because she was weak in her left side. And so it's fun because every day is different. Just like most social work jobs, every day is different. You make a difference in people's lives, and you do good work. So I guess that's really it. What else can I say about it? Since we work from home, we have bi-weekly staff meetings. We do have a place where we can go into work if you wanted to every day. We go into the office to print things and mail things off and that kind of thing. So we have just enough interaction with other people where we don't get bored of being at home. But sometimes I'm at home for 2 weeks straight without going into the office or seeing anybody. And that's good sometimes, but sometimes you do want to have socialization. So I think that's pretty much it. So any questions about what an ambulatory care manager does? And not everybody works from home. Like not every hospital or company that you work for as an ambulatory care manager, you won't be working from home, I'm sure, but where I work particularly, we do. So any questions, any comments, if you work in a similar field or if you do the same kind of work and you do something different, let us know in the comment section. And like I said, I'm looking for new content ideas for videos. So let me know if you have anything that I could do a video on, and I will get that out to you. All right, so happy studying. Continue to work hard at it. You will pass the exam. You can pass the exam. You're capable of passing the exam. This exam does not define you as a social worker. So happy studying, and I'll see you in the next video.